Good afternoon, everyone. This is Dr. Mesheca. Welcome to I Have a Question. I am your host, Dr. Mesheca. So I'm joining you live today from Maryland. It is such a wonderful, wonderful day. I'm actually out for an afternoon walk. I think I've been walking out here since about 1:40 p.m. So I've been walking quite a bit. How can you not? It's just we're supposed to get out and get that vitamin D. But also we are exposed to UV rays, and you cannot be overexposed to UV. So what would overexposure to UV rays look like? Well, overexposure to UV rays can basically cause skin problems like premature aging problems. Wrinkles around the eyes is what we see as eye doctors, as well as wrinkles in the skin. So it can definitely show some signs of premature aging. But as an eye doctor, as an optometrist, UV ray overexposure can cause, or just exposure in general, can cause eye problems like cataracts. So cataracts are a clouding of the lens inside of the eyes as we get older. So hi Dr. Lakeisha, thanks for joining. So we all will develop cataracts at some point. Now, I can't tell you that cataracts, you'll have cataracts at the age of 40 or 50, because I see cataracts as early as patients that are in their 40s. But just know that cataracts are caused from UV exposure from the sun. Another problem that we see with UV exposure is a disease called macular degeneration, or you may have heard age-related macular degeneration. That is a disease that can definitely cause you to go blind. So you want to make sure that your eyes are protected from the sun, from all of these UV rays. So there are a couple of things that you can do. Like, I am taking a walk. I'm actually taking a walk at one of the worst times, because the UV ray exposure is highest between about 10 a.m. and 4 p.m. However, I'm trying to make sure that I'm not out here too long. But on the other hand, like I mentioned before, I do need my vitamin D just like you do. So you can make sure you're walking at a certain time. Also, in terms of your eyes, well, let's talk about the skin, since I started with the skin. With the skin, you want to make sure that you are wearing a sunscreen, SPF protected sunscreen. And then as far as your eyes, you want to make sure that you are wearing some type of protection. So I am an optometrist. I have a full service optical in our office, Special Eye Care. And so we would recommend one of two things: either a pair of prescription or non-prescription sunglasses, where we know that they would have adequate UV protection, or we might recommend what I'm wearing today, which are called transitions lenses. These lenses are amazing, because not only can I wear them inside, but I can wear them outdoors, because they adjust with the sunlight. So these are just great lenses. So make sure when you do go to your eye doctor that you ask them about these particular products, because they are great. So again, I just wanted to jump on and talk to you about UV exposure. Yes, Dr. Lakeisha, we will all develop cataracts because it's a normal aging process. I can't tell you when you will develop them, but basically when we're born, we are born with this structure called the lens that is crystal clear. But as we get older and we're exposed to the sunlight, that lens becomes yellow, it becomes hard, it becomes not as flexible as it's supposed to, because it helps us with focusing. So we will definitely all develop cataracts. I'm just going to see if there are any other questions. Hi, Dr. Celeste. Thanks for joining. I'm just out here talking about Ultraviolet Awareness Month and how we should protect our skin and our eyes from overexposure to UV rays. So I am going to jump off and finish my walk. I've been out here for an hour, so this is a little longer than I normally am. I am Dr. Mesheca, leader in optometry and advocate for your eyes. You can catch me on all social media at Dr. Mesheca. That's DrMesheca. Feel free to like this message, share this message, and send me questions. I want to talk about things that you want to know about your eyes. Take care. Have a good day. Bye-bye.